Welcome to Adapting Class. This is part 2 or number 2 of our fundamentals of nursing and practice questions. This is our concept, things you're supposed to know. I put them in the question form. So let's get to it. Straightforward first question. Which of the following need immediate intervention? That means you did something wrong or the patient is doing something wrong. You have to know these devices, ambulatory devices or assisted devices that patient is going to be using when they get sick. A nurse is observing a client walking with a cane after left ankle sprain. Look at what I've done. Things that will help me answer the question. Walking with what? Cane. What is the problem? Left ankle sprain. Therefore, I know that the left ankle is affected. The right is unaffected. So when I'm answering questions, I'm focusing on that. And I'm using a cane. Clients hold the cane on the left side of the body. When you use cane, the cane should be on what? Unaffected side. Left side is affected. This is a problem. Client advance the cane and the left leg. Yeah, because the left leg is affected, you have to advance it with the cane to provide some support. Right, the client advanced the right leg past the cane. Yeah, you got to advance the right leg, the good leg past the cane. That's how you advance forward. Client hold the cane 15 centimeters in front and towards the side of the what? The unaffected side, which is the right. Client cane height is at the wrist. Sometimes it's at the wrist or the greater trochanter. So just pay attention. If they don't put greater trochanter, they will give you the wrist. So the only one, which of the following need intervention is one. The cane should be held on the unaffected side. Left side is affected, it should be held on the right. Like I said, you got to master them. These cases, questions are all about, most of them are assisted devices. It's 50% of them. Which of the following need immediate intervention? The nurse is observing a client goes up the stairs. Is going up the stairs with what? A cane after what? Left ankle fracture or sprain. I'm trying to confuse you. Now we're going up the stairs with the cane. The left side is also affected. How do you advance? Pay attention. Look at what the patient is doing. If you see something wrong, yeah, you pick it up. Client take the first step with what? Right leg. Right leg is the good leg. Therefore, you go up with the good leg. So, good one. Client move cane before the affected leg. Before you move the affected leg, you got to have support. And so you move the cane for that. This is good. You can also hold the handrail. The client uses the handrail as needed for support. You're supposed to look forward. If you look down on looking at your leg, you're going to fall. So this is wrong answer. So you need intervention. Look forward as you move. There's a temptation to look down so that you think you're going to fall. But when you look down, you're more likely to trip and fall rather than looking forward. So that's the answer, number 4. Number 3, another quick, the same thing, right? I'm trying to get you thinking. After teaching the client how to use what? Now crutches due to what? Non-weight bearing right leg. I'm trying to confuse you. That means the right leg is the one that is affected. I've underlined the bars ways to focus on it. Crutches, right leg is affected. Which of these need immediate intervention? Which of these need intervention? So you're using crutches and your right leg is the affected leg. Your elbow should be flexed at 20 to 30 degrees. You need to know these little details. If they ask you a question, trust me, these are the things they will put there. So this one need intervention. Both crutches held at the left side. That means the good side when sitting down. This is key. Your right leg is affected. When you're sitting down, if you put the crutches on your good side, you're going to fall. The key, if you have crutches and you're sitting down, or bring the two crutches to the affected side so that you can use your unaffected side as your strength and you go down that side. So you can be holding the crutches. You don't have weight anymore. The right side is weak. So don't hold both crutches. You got to give both crutches to the bad side. That is the right side. It does need intervention. Crutches at 15 centimeters in front and side of each foot. This is great. There is 2 to 2.5 centimeters space between the axilla and the pad. Yeah, you should not put your armpit right, that's the axilla, right on the pad. There should be some space to prevent nerve injury. So this is okay. Client move the crutches and the affected leg. Because their leg is affected, the crutches is your support. So you move it together with that. And that gives you the 3-point stand. So this is fine. Therefore, which one need intervention is 1 and 2. I'm just trying to give you concept, right? Number 4, after teaching a client how to use crutches, the same thing. For 2-point gait, you have to know the type of gait. You know, there's the swing through, there's a 2-point, 3-point, 4-point swing through, all of them. Which of the following indicate correct understanding? How do you understand 2-point? That's all. That's what I want you to. And this is sometimes you got to think about it carefully. 2-point. The first one, alternate each leg with opposite crutches. What do you think? When you're alternating them back and forth, each leg with the opposite. So the one crutch and the left, if you move the one crutch and the left leg, another crutch with the right leg, what are you doing? That is a 4-point. This is 4-point. When both crutches are moved with the injured, so this crutch is moved with the one injured leg, this is what you can count, 1, 2, 3. This is 3-point. This is 4-point because you move one crutch, then you alternate, you move one leg, you move another crutch, you move one leg. So there's 4 points of attachment. That is 4 points. This one, you move the crutches, 2 crutches, and one leg together. You're going to have one on the floor and the other one is up. The injured leg will be up. There's 3 points. Move opposite leg and crutches together. So this is one crutch, one leg together, one crutch, one leg. So this move together, this move. So you have this moving together, this moving together. What do you have? 2-point attachment. When you have this move, then this move, that's crutch, then leg, crutch, then leg. You have 4 points of attachment. I hope this makes sense. So this is a 2. Then bear weight on both legs. As you can see, you move one crutch, then followed by the leg, one crutch followed by the leg. This is 4 points. That means both legs, you bearing weight on both legs. This is 4 points. So 2-point gait is like you walking. You move one and the right arm and the left leg and the left and right. So right arm and the left leg, left arm and the right leg. You alternate it like that. So this is opposite leg to that. So that's 2 points. That's number 3. Number 5. After teaching a client who report of constipation, which of the following diet choice indicate correct understanding? Only where you see, I always underline the buzzwords. Which of the following diet choice indicate correct understanding? Constipation, that means you need fiber. That means you need water. Okay, that means you need exercise. Okay, so we're talking about fiber. That is your best thing. Which of these give you a lot of fiber? Burgers and fries is negative. Yellow rice and fish, maybe some small fiber here, but this is not enough. Apple and potato with skin? Yes, good. Macaroni and cheese, there's no fiber there. That's all. All the questions asking you, fiber therapy. That's all. Number 3 is your answer. You see, the questions are trying to let you think. Simple, forward, straightforward. That's the board questions are. They are not that long. They're very short, but it has loaded. So you have to pay attention to the keyword. Which of the following die choice, the same thing, indicate correct understanding? A nurse is taking care of a client who has an order for what? Low residue diet. Which of the following die choice indicate correct understanding? That means which of those, rewrite the question in your own words, low residue diet. That's all. That means, what does that mean? Low fiber diet. That's all. We did high fiber, now we're doing low fiber, which is low residue. Therefore, if I see a bunch of fiber answer choice, I'm taking it out. If they look the same, I'm taking it off. Oatmeal, I know it has a lot of fiber. Cabbage, I know it has a lot of fiber. Black beans, I know it has a lot of fiber. There's no way 1, 2, 3 should be the right answer. They look the same. I'll choose a cup of yogurt as my right answer. That will be low residue diet, low fiber diet. Number 7, same strategy. You see short questions, but it's loaded. Who should the nurse see first? The nurse will receive report on 4 clients at change of shift. You have to be sharp. And what does that mean? You take care of the breathing problem. You take care of the electrolyte, shock sepsis, hypothermia, hypoglycemia, hypoglycemia. You take care of airway issue. Then what do? R, you take care of somebody who has neurological problem, lethargy, and pain that is going to kill you, life, limb, eyesight. What do we have? A client ready for discharge after appendectomy. Stable patient, ready to go home, discharge. Maybe I have some time for it. Client with what? Rapid shock of this. We have hypotension patient. We have a shock problem here. Client with saturation 91 after oxygen increase from 2 to 3 1 hour ago. And if you receive report, I'll classify this airway or breathing problem. Why his sat is going down. Pain 9 of 10 post-op and his incision. Did I say the patient has garden? Did I say patient has board-like abdomen? There is no peritonitis. Incisional pain is not going to kill you. Therefore, this is gone. Appendectomy have time with you. I have shock and I have somebody who is desaturating. His SATs was increased from oxygen was increased from 2 liters to 3 liters. And you just received a change of shift. You want to go see somebody who have a blood pressure problem or somebody whose SAT is dropping. You don't know whether he responded or not. But his SAT is 91. There's something wrong. We got to see this patient. Number 8. A nurse is educating new graduate about leadership style. There's different kind of leadership. You have to know this. This is management issue. Which leadership style make every keyword, make very few decisions, and that's little planning for this staff. Bunch of buzzwords. You make little planning for the staff and make very few decisions. That means not involved at all. Authoritative, as the word sounds. It's all over your face. Gone. Democratic, involve the staff. They said, make little planning. Okay. Compassionate, Miss, you are compassionate about the problem. This, it sounds like lazy person. He make few decisions and does not involve in anything. So that's your problem, laissez-faire. The next is educating new graduate about the different characteristics of leadership. The same thing, character. What kind of character did they have? Which leader focus on what? Immediate problem, buzzword. Or he care about status quo, maintaining things, and uses reward to motivate you. Authoritative, I told you, is all over your face. Transformational leader does not do that. What he does is empower you, okay, is for long-term capability, and he inspire. So all he care about long-term stability of the problem and then of the situation of the environment and empowers you and inspire you. Transactional, as they sound, is all money. So you focus with reward and status quo and immediate transaction. When you transact, you make money or you using money right now. Immediate problem, let's solve it. So transactional leader are like that. They focus on immediate problem, the status quo, and the reward. Transformational people, they empower you, inspire you, and they are for long-term effect. Authoritative is all over your face. Who is an authentic leader? Authentic leader, what they inspire you to follow them, and they use specifically moral code. They have a specific, they inspire you to follow them, okay? But they use some moral code to get you, okay? They motivate you, they focus on your moral aspects to follow you, and that's the authentic leadership. So this question talking about status quo, immediate problem, is a transactional leader. Number 10. This is also a little bit harder. Which stage of conflict the nurse is exhibiting? A nurse is mad at the supervisor, mad, keyword, at the supervisor after instituting a new 2-hour end of shift report requirement. What stage is the conflict the nurse is exhibiting? So there's 5 stages. There's latent, there's perceive, there's felt, there's manifest, and aftermath. I give you this as a content. The first one is latent. So this is number 1, 2, 3, 4, and aftermath when he had after that. You have to know the difference. What is a latent one? A latent one means there is no conflict. Okay, there's no conflict, but there is potential for conflict to come up. So you have no conflict right now, but there is something that has happened that is a potential for conflict to happen. Perceive one is one person perceive the conflict, but there is no conflict. Okay, there is no conflict actually, but one person is perceiving that there's conflict that is going to is already existing, but there's no conflict. 3, felt. Okay, felt means one party felt the conflict as existed and emotionally reacting to that. So one person has felt it and involving feeling the emotional response to that. So they're using their emotional response to the conflict that now has instituted. And manifest, what does that mean? To manifest, both party now know that there's a conflict and they're working to fix it or they're not working to fix it at all. Aftermath is aftermath of the conflict, and it can be positive or negative. Positive means we all did what we did and we comply with the situation. Aftermath or negative, no. People are not still now happy with it. So these are the 5 stages of conflict. As you can see, it's mad. The nurse is mad. Emotional response to the conflict that is existing. This is felt conflict. So that's number 3. It's a hard question. You have to really know it. This type of questions are hard. Number 11. This also is very good question. Which of the following action need further teaching? 4, by select or apply. After teaching a client with right ankle, that means bad side is right. You see the way I write it so that I don't get confused. Fracture, how to sit down, which of the following action. So that means the patient, what? He has a right ankle fracture. He's going to sit down. How does he sit down? Okay. Which of the following action need further teaching? After teaching the client with right ankle fracture how to sit down, which of the following action need further teaching? I left out the crutches, but that's the patient is using crutches, so we can fix it. Client back to the chair. Yeah, if this is the chair and the client is here, his back is facing the chair. So this is correct. Both crutches held by the hand of the unaffected side. I've explained it to you. If you are using crutches, you should hold it. When you come in to sit down, give both crutches to the affected side. The affected side is to the right side. But he's holding the client is holding the crutches on the unaffected side. That is 4. Therefore, this is a problem. Need further teaching. Hold arm rest with the hand of the affected side. No, the affected side is weak. If you hold that side with the arm rest, you're going to put your weight on that side. You should hold the arm rest with the unaffected side. That is why number 2 is wrong, because number 2, if you give the crutches to the affected side, and then you use the unaffected arm to push on the armrest to support you. So this one is wrong. And lower your body down. So that's right. So 2 and 3 need further teaching. And last one. A client with BMI of 17 needs subcutaneous injection of Enoxaparin. Which of the following actions is appropriate? That means somebody with a BMI of 70. Always when you look at a question, when they put some words there, there's a reason why examiner is giving you. They want you to think. BMI of 70 is too low. This is like an anorexic patient or something like that. And I'm going to inject Enoxaparin, which is giving sub-Q. Usually 45 degrees and 90 degrees. 45, if I can pinch 2 centimeters of your body fat. If I cannot pinch more than 2 centimeters of the body fat, is that. But if I can pinch greater than 2 centimeters, then I inject 90 degrees. 15 if for intradermal. There's nothing like 75. So it's between this and that. 90 is when your BMI is high. 45 when your BMI is low. Concept questions for you to think about. 12 of them. I hope you're satisfied. Take care of yourself. Subscribe if you don't subscribe. Join our membership if you have not. Take care of yourself and keep charging. Adapting class is out. Bye-bye.